I'm Naima Latif with your Media Connection News Brief for Tuesday, November 17th, 2020. In local news here in Chicago, Chance the Rapper announced that he is hosting a Thanksgiving turkey giveaway. The announcement came on a recent episode of The Tonight Show hosted by Jimmy Fallon. And Chance the Rapper's charitable organization, Social Works, will host this giveaway at three locations on Monday, November 23rd, and three locations on Tuesday, November 24th. A total of 250 turkeys will be given away at each location, and they are first come, first served. And of course, there will only be one turkey per family. The giveaway locations for Monday, November 23rd are from 12 noon to 2 p.m. at Michelle Clark, 5101 West Harrison Street. From 3 p.m. to 5 p.m. Inlace at 3000 South Lawndale Avenue, and 6 p.m. to 8 p.m. at Hugs No Slugs Safe House, 8256 South Shore Drive. The giveaway locations for Tuesday, November 24th are 9 a.m. to 11 a.m., the Progressive Baptist Church, 3658 South Wentworth Avenue, 12 p.m. to 2 p.m. at Lilydale Baptist Church, 6649 West 113th Street, and 3 p.m. to 5 p.m. XS Tennis Facility, 5336 South State Street. Again, first come, first serve. 250 turkeys per location, one turkey per family. In national news, recent studies have shown that there has been an increase of young adults moving back home with their parents as a result of economic challenges brought about by the COVID-19 pandemic. This, of course, has a positive effect that is unexpected because there are more families that are living together. There is more family time being spent with children and grandchildren, and money saved. Now that millions of young adults across the country are living with parents, this has had a positive impact on family life and helping children to get more time with grandparents that they normally would not see as often. During the Great Depression in the 1930s, 48% of young adults lived at home. Now in 2020, we've surpassed that statistic with 52% living with one or both parents. And as of July, the numbers have increased. And according to the Pew Research Center, 2.6 million adults made the move back home between February and September of this year. Philip Powell, Associate Dean of Academic Programs at IU Kelley School of Business, said that when all of a sudden, when they're faced with a lot of job insecurity and the pandemic, which creates a lot of health concerns, it's a logical decision to move back home. And it also helps ease tensions when, in fact, the nation is facing a shutdown and families are being urged to stay at home. In global news, while the infections have spread worldwide, COVID-19 cases have been declining across the African continent since July of this year. The reason, according to the World Health Organization and other experts, is a result of a combination of public health measures paired with a strong socio-environmental factor. Dr. Moeti Tshidi, Regional Director for Africa for the World Health Organization explains why Africa has experienced a different kind of pandemic and what factors were put in place that helped to protect the people. First was the timely response. Early on, some worried that a shortage of health professionals and equipment would make battling COVID-19 difficult or even catastrophic for the African continent. And others worried if preventive measures such as hand washing could be easily adapted to varying contexts where fresh running water could be difficult. But years of experience battling previous pandemics helped ensure the continent's response was swift and more tailored to local needs and capacities than it might have been otherwise. Many nations were galvanized to seek out solutions themselves rather than wait for resources or support. Dr. Matshidiso Moeti, World Health Organization Regional Director, has stated that Africa has not witnessed an exponential spread of COVID-19 as many initially feared, and has certainly set an example of how to control the spread of a pandemic. Also, age plays a factor. Africa's younger population has helped keep the case numbers and deaths down. Around 40% of the continent's population is younger than 14, according to World Bank data. Algeria, one of the continent's most affected countries, also has one of the larger shares of older residents. 6.5% of people are 65 and over. What's more, Africa's culture is more inclusive of older people, and many live with their families instead of in elder care homes, which have proven to be highly risky environments for seniors. What we can say we've learned from the spread of COVID-19 is that more involvement with family members, families living together in close proximity, elders being in the care and presence of their children and grandchildren, seems to be a positive factor in keeping families healthy. Has the COVID-19 pandemic taught us something about our culture and about our families that may keep us healthier in the future? Time will certainly tell. I'm Naima Latif with your Media Connection News Brief for Tuesday, November 17, 2020.